Welcome to those of you that have joined our call tonight. Even though we are still dialing people, we're going to go ahead and get started. My name is Greg Thompson, the Executive Director of the Personal Assistance Services Council, and I'd like to thank you for being on our call tonight. Tonight we're going to pick up on our series of discussions about Cal MediConnect. If you've missed our last 3 discussions on Cal MediConnect, you can find them on our website at www.pascla.org. Again, www.pascla.org. Tonight's call is being sponsored by Molina Healthcare. With that said, I'm going to take a few minutes and go over a few specifics about tonight's call. If at any time you would like to ask a question of one of the presenters, press *3 on your phone. Again, if at any time throughout tonight's call you would like to ask a question, just press *3 on your telephone. We encourage and welcome your questions, so please press *3 to ask us a question. Not all the questions are going to go live in the next hour. However, if your question does not get answered during a live question and answer session, someone will return your call within 48 hours. Also, if you have a question that is health plan specific, those questions will be given to the health plan at the end of the evening, and you should receive a call from the health plan within 48 hours. We are also going to be asking you questions tonight. Now, how that works is I will ask a question followed by some possible answers. You will select the number on your keypad that corresponds with the answer. So, for example, if I ask a question, what day of the week does Easter fall on? Then I will give you 3 answers, and you'll pick the one that is correct. For instance, press 1, Thursday, press 2, Friday, press 3, Sunday. So you would press number 1, 2, or 3 on your telephone keypad. And at the end of the call, you can also leave a voice recorded message, comment, or question, and someone will return your call. So, of course, tonight we have some great guests with us, and I'd like to begin by introducing Amber Cutler from the National Senior Citizens Law Center. Welcome to our call, Amber. So, Amber, here we are again talking about Cal MediConnect. Now, although this is an extremely complicated program, I was hoping that you could kind of break it down and give a simple overview of Cal MediConnect and its purpose to our callers. Glad to have you, Amber.
Thanks, Greg, and I'm honored to participate in the call. So I'm going to break down what Cal MediConnect is, and I really encourage people, again, to ask questions about the program by hitting the *3 function. Like Greg said, my name is Amber Cutler. I'm a staff attorney with the National Senior Citizens Law Center, and I'm based here in Los Angeles. The Cal MediConnect program is a new type of health plan that's available to individuals who have both Medicare and Medi-Cal benefits, or dual eligibles, or Medi-Medis. The health plan, the Cal MediConnect health plans, provide both the Medicare set of benefits and the Medi-Cal set of benefits, including your long-term services and support, so like IHSS, and your prescription drug coverage. The Cal MediConnect plans also offer additional benefits that Medicare and Medi-Cal do not pay for. For example, the Cal MediConnect plans provide vision benefits and non-emergency transportation benefits to medical services. The other major benefit that Cal MediConnect plans offer is the care coordination benefit. Care coordination means that there's someone at the health plan that will be responsible for helping you coordinate your benefits and get your services. You do not have to join a Cal MediConnect plan. It is optional. That means that when you receive notices about Cal MediConnect, you're going to need to make a choice. It's also important to recognize that if you join a Cal MediConnect plan, You might have to change providers or switch doctors or hospitals that you currently see if you're in a Cal MediConnect plan. So you'll need to check whether your doctors and providers are part of the Cal MediConnect health plan. There are 5 Cal MediConnect plans in Los Angeles County. They are Care First, CareMore, HealthNet, LA Care, and Molina. Again, they are Care First, CareMore, HealthNet, LA Care, and Molina. Like I said, you do not have to join a Cal MediConnect plan. You are going to receive notices about this new type of health plan. Those notices are going to come in blue envelopes, and on the top of those notices, they are going to say Cal MediConnect. You are going to want to read those notices very carefully and make a choice that is best for you. The choice that you make is very specific to you, because whether you want to join a Cal MediConnect plan is going to depend on whether your providers are part of the Cal MediConnect plans network and whether you want some of those additional benefits that Cal MediConnect has to offer. Why it's so important that you make a choice is because if you do not make a choice, you will automatically be enrolled into a Cal MediConnect plan. So again, it's very important that you read your notices and you make a choice, because if not, the state's going to make the decision for you. There are resources to help you make that choice. You don't have to try to do that all on your own. The major resource that's available in Los Angeles County to help you is the HICAP, known as the Center for Healthcare Rights, and you can contact them at 1-800-434-0022. Again, that's 1-800-434-0022. They have counselors that can help you work through the choices that you face and help you make that decision about whether you want to join a Cal MediConnect plan and what Cal MediConnect plan you want to join. That counseling is free, and I really encourage you to use that resource to help you make that choice. So if you decide that you want to participate in Cal MediConnect, you'll want to decide which Cal MediConnect plan you want to choose. And if you decide that you don't want to participate in Cal MediConnect, it's important to know that you still have to choose a Medi-Cal plan for your Medi-Cal benefits. The choice of having your Medi-Cal in a health plan is not really a choice, it's mandatory. If you have Medi-Cal, you're going to have to join a health plan for your Medi-Cal benefit to continue receiving your Medi-Cal benefit. You have the option of joining the Cal MediConnect plan that will also include your Medicare benefit, but joining a Medi-Cal plan is mandatory. I think, Greg, that's a summary of the program.
Wow, thanks, Amber. That's an excellent summary, but it's still an awful lot of information. So, Amber, how do you think Cal MediConnect is going? I know it was got off to a rough start with enrollment. Do you think that they've improved a little bit since we started this in July?
That's a great question, Greg. I do think that there were a lot of issues at the beginning with enrollment. A lot of populations received notices that they shouldn't have received. Some people were enrolled and should not have been enrolled. And I do think that the state and the Centers for Medicare and Medicaid Services federally have been ironing out a lot of those different problems. We're seeing a few new ones pop up, but I think a lot of those initial enrollment issues have started to work themselves out. Keep in mind that if you're facing an enrollment issue, there is a resource to help you with that, and that's the CCI Ombudsman. The Ombudsman helps you with issues with enrollment or disenrollment, or if you're having any issues with a Cal MediConnect plan. So I recommend that people use the Cal MediConnect Ombudsman or CCI Ombudsman if they're having issues. And that phone number is 855-501-3077.
So, Amber, last time I counted, people were going to get about 10 notices. I'm exaggerating a little bit, but is there any way, someone like me who doesn't like to open their mail, is there anything special about the notices that the state's sending out?
There is. You're going to receive 3 major sets of notices, and they're going to start, for the most part, about 3 months before your birthday. There are exceptions. Some people aren't going to go in by birth month, But for the most part, you can expect to start receiving notices 3 months before your birthday. The notices will come 90 days, 60 days, and 30 days. And those notices are going to come in blue envelopes. So you want to watch your mail for blue envelopes.
Excellent. Thank you, Amber. You mentioned care coordination. You gave a brief summary of it. Can you expand a little bit on what care coordination is supposed to look like in the health plans?
Sure. So the Cal MediConnect plans are required to provide care coordination. That is a required benefit that the health plans have to provide to members who join a Cal MediConnect plan. The health plans will have someone who will be a care coordinator. That's kind of, if we want to use a football analogy, it's like the quarterback, someone who's responsible for helping you manage all of your benefits, someone who's kind of in charge. And then each of the health plans have to conduct what's called a health risk assessment. That means they're going to contact members of the health plan to find out what's going on with their health issues and figure out if there are any unmet needs that they have, and any way that they can provide additional services to help people continue living in the community rather than going into a nursing facility or risk a hospitalization. So the care coordinator will get the information from the health risk assessment, and together they might create a interdisciplinary care team to help serve you that could be composed of the care coordinator, the member's family members or friends, the primary care physician or specialist if the specialist is acting as the primary care physician. It could include the IHSS provider if the IHSS consumer wants the IHSS provider, or any other person that the member of the health plan wants on the care coordination team.
Great. Thanks, Amber. And so remember, you want to open that. Okay, I think we're going to try to our first poll question. So remember, I'll ask the question, and following the question, I will give you 3 possible answers. You choose the answer and press the button on your telephone. All right, so our first question is, in making a decision regarding most influenced by, press 1, my doctor or pharmacist, press 2, my significant other or family member, press 3, my home care worker, press 4, other. Let me repeat that. When making a decision regarding my health care, I am most influenced by, press 1, my doctor or pharmacist, press 2, my significant other or family member, press 3, my home care worker, press 4, other. All right. So Julie, are we ready to take some live questions about Cal MediConnect? And remember, if you have a question, just press *3. Okay. So, Julie, do we have a question?
We have Bridgett.
Hi, Bridgett. Welcome to our call.
Yes, I didn't get a clear understanding in the beginning. Do you have to have Medi-Cal and Medicare for this program?
That is correct. You have to have both Medicare and Medi-Cal for Cal MediConnect.
Okay, I would not qualify for that. My daughter would. Is it a way she can contact you?
She's going to get notices in the mail if she's eligible for the program. So she doesn't need to do anything. She might want to talk to her doctor about it, but right now she can just wait for those notices to come in the blue envelope.
Okay, great. I'll inform her about that.
Great.
And thank you so much.
Okay. Deborah?
Deborah?
Deborah, do you have a question?
Yes, I do have a question. I checked with my doctor about this this situation that you have here, and they have told me they refuse to participate in any of these plans. So that will make me have to pay for my health care, which I cannot afford, because that's what makes me eligible for Medi-Cal. So what am I supposed to do?
Your doctor doesn't, if we're talking about Cal MediConnect, you can decide that you don't want to participate in Cal MediConnect. So when you receive your blue notice, your notices in your blue envelopes, and you get a choice form, you're going to either want to fill out that choice form or call Healthcare Options and tell them that you don't want to participate in Cal MediConnect. You're going to just join a Medi-Cal plan.
But this is the problem that I have. They've already told me that even if I stick with because I'm Medi-Medi, if I keep Medicare as my primary, the part of the health care that I receive that Medi-Cal pays for, they are not going to accept the Medi-Cal plan. So I will have a medical expenses that I did not have prior to that. Every time I go to the doctor, it's over $300. I don't have that kind of money.
Your doctor does not have to be a part of the Medi-Cal plan for your doctor to get paid the Medi-Cal portion of the payment. Let me repeat that, because this is a big misunderstanding that Medicare providers have. They do not have to contract with the Medi-Cal plans in order to receive their Medi-Cal payment. The Medi-Cal plans are taking the place of the state and paying the Medi-Cal portion. The other thing is that you in no circumstance will have to pay the Medi-Cal portion. If your doctor bills you for that Medi-Cal portion, they can be sanctioned by Medicare for billing you. As a dual, as a Medi-Medi, you are not supposed to be billed for any portion of the services that are covered by Medicare and Medi-Cal. If that happens, I want you to contact the Ombudsman. Again, I'm going to repeat their phone number for you. It's 855-501-3077. And if you want your providers, if they're still telling you that, if you want to tell them to contact the state to get the correct information, because that's incorrect information that they're giving you. Okay?
Thanks for clarifying that, Amber. Julie, do you want to take one more question? Hi, Susie, are you there? Susie, go ahead and ask your question.
I was wondering, my doctor, I went to her, and she said she can only take one question per visit because of Obamacare. In other words, if I save up everything to go there, because I can't keep going, I take the access bus, and it takes a long time, and my caregiver can't go that long. But I can only ask her like one thing, you know?
I don't know why your doctor is saying that they can only take one question because of Obamacare. I don't know why your provider would say that. There is nothing in the law or about any of these programs that would make that be the case. Is
there any way that this could be looked into?
Well, I think that if your doctor is saying that, you might want to consider switching doctors.
No, I did switch. That's the whole thing. I went to him for 15 years, and I have an 80-pound tumor on my right hip, and he never did anything about it, so I switched. And I switched to 2 or 3 different doctors, and they didn't do anything about it. Luckily, just recently, I went to City of Hope, and now they're doing something, because it's so huge.
Yeah, I don't think we can help on this conversation. I don't even know what it is. Yeah.
So hi, this is Deborah, and I work for Molina, and I work with the case managers. And if you were a Molina member and you were telling me about this, we would help you have a conversation with your doctor to help sort out your concerns, your questions, and get the answers you need so that you are confident that you are getting the right health care. So I really encourage you to talk to your health plan. Tell them.
That's it. With Medi, I don't have a health plan. I'm with a specific doctor.
So if you decide to join Cal MediConnect, the health plan you work with will have case managers who can help you with this. So, and we work with people who are sorting these kinds of questions out every day.
Thank you for that question. I know it's a difficult situation, but if you call the people that we've recommended, I think they can help you out with that. And thank you for all the other questions. Now, I want to take a few minutes to review for those of you that joined us late or may have to leave early. If at any time you'd like to ask a question, press *3. Press *9 to leave a recorded message. And if you'd like a recorded copy of this and past Tele-Town halls, press *3. Now, we've been talking about Cal MediConnect, which is a new partnership program between the state Medi-Cal program and the federal Medicare program to improve care for California's seniors and people with disabilities who are duly eligible for both of these public health insurance programs, otherwise known as dual eligible beneficiaries. Cal MediConnect aims to improve care coordination for dual eligible beneficiaries and drive high quality care that helps people stay healthy in their homes for as long as possible. Additionally, shifting services out of institutional care and into home care and community. This will help create a person-centered healthcare system that is also sustainable. All right, you heard from Deborah, but let me formally welcome and introduce Richard Chambers and Deborah Miller from Molina Healthcare of California. Richard is the president of Molina Healthcare, and Deborah, as she mentioned, is the vice president of healthcare services at Molina. Welcome, Richard and Deborah. I wonder, could you give our callers a brief description of Molina Healthcare?
Sure, Greg. This is Richard, and thank you very much for that introduction. And I want to thank Amber, too, as what a great overview of the Cal MediConnect program. I just wanted to tell you we're also joined here today by Lisa Hayes, who's our Director of Disability and Senior Access. So Lisa, Deborah, and I will be giving an overview and answering questions the rest of the program, so we look forward to talking to you. Before we started, as Greg asked, I thought I'd just give a brief overview of Molina Healthcare, since a lot of folks in LA County don't really know us very well. And so I think it's always important for folks to know is like where we came from to understand where we are today. Molina Healthcare started 34 years ago right here in Los Angeles County. Dr. C. David Molina was an emergency room physician in the city of Wilmington, and he noticed a lot of individuals coming into the emergency room of the hospital who either had Medi-Cal or low-income Medicare beneficiaries or the uninsured who were accessing care through the emergency room rather than having the ability to see a primary care physician where a lot of the things that were wrong with them could be addressed in that setting. So Dr. Molina set about in 1980 of opening a clinic right there in the city of Wilmington to serve low-income populations. That vision from the beginning grew to where Molina is today. Here in the state of California, we're a managed care organization that serves Medi-Cal beneficiaries in 6 counties, including Los Angeles County, and have had a Medicare program, and now we're also participating in Obamacare or Covered California. And so, you know, from that very humble beginnings here locally in Los Angeles County, we've grown to an organization that has health plans in California and 10 other states and serve 2.3 million beneficiaries across the country. Why that's important is because we as a company have gained a lot of experience over the years in serving low-income populations who are served by government programs, particularly in populations such as seniors and persons with disability here in California, Medi-Medis or dual eligibles. We have a special needs program. So we've had years and years of experience in dealing with medical programs that serve these populations. I'm really proud, though, of being part of the Cal MediConnect program because of what the vision of it is that Amber laid out earlier today. What we hope to be able to do is to be a health plan for individuals who are eligible for the program to choose and want to be part of, because we really want to deliver a patient-centered, coordinated and integrated care system for delivering both acute care services, physicians, hospitals, and other services, but also long-term services and supports. You know, this is not about a medical model anymore. It's about making sure we coordinate and integrate all services, social services, in-home supportive services, the MSSP program, CBAS, behavioral health. We want to make sure there's one organization to go to coordinate and integrate all that care, and that we make sure that we promote independence and prevent individuals from going into a long-term care facility, and where we as an organization, as a health plan, can be your partner in delivering those services. So tonight we look forward to answering questions about the program specifically, and Greg, I'll turn it back over to you to go on from here.
Thank you, Richard, and thank you for acknowledging Lisa. I mean, how can I forget Lisa? I apologize for that. You talked a little bit about care coordination, and my first question would be, how does Molina Healthcare view the Cal MediConnect program, and how do you plan to make the goals work? I mean, what's different about Molina Healthcare?
So this is Deborah speaking, and Molina has made a very large investment in hiring care coordination staff and training them well. We have over 300 care coordination staff. More than 50 of them are bilingual, and that represents 11 different languages, and they serve the members telephonically and in the community in their homes. So we want to really understand the member that we're taking care of. So we visit people at home. We conduct the health risk assessment face-to-face. And oh, by the way, home can be any place the member feels comfortable with an interview. So sometimes we meet people at Starbucks. Sometimes we meet them at the doctor's office. Sometimes we meet them at a psychiatric facility. Sometimes we meet them at the CBAS Center, wherever they are, wherever they're comfortable being interviewed and having an assessment. So our job really is to understand a person's needs and to mobilize a collaborative response to their needs. So if they need help accessing services and programs like in-home support services, we work with them and with IHSS to make sure they get an assessment and we get the services rolling so that they can get care at home. We also work closely with medical providers, behavioral health providers, and those agencies that provide those services to make sure that services are accessible and they're received timely. We really focus on the idea of self-direction. We really try to assist the member in identifying what's most important to them about their own health, help them identify what kind of assistance they need in coordinating services, help them make some decisions about what's most important in terms of their health. We often assist people or promote the idea or help people understand the idea that they can select their own caregiver, train them, fire them when they want to. We also make sure that we don't put anything in a care plan that is not okay with the member that we're serving. So we do all of that, and we help the member determine what it is they need, help them speak to their doctor, and speak to any other community agency who might be helping them. We also help people who are transitioning from one level of care to the other so that the transition is smooth. So if someone's leaving the hospital, going home, we work with them over a 30-day period to make sure that everything's in place, they're getting their medications when they need them, that they have a follow-up doctor's appointment, and that they know what to do if something's going wrong. So again, we're helping people to try to get the maximum benefit from the services and benefits that are provided to them and make sure they know how to access those.
Thank you, Deborah. You mentioned in-home supportive services and self-directed care. One of the frequent questions and concerns that we're hearing about is, are the health plans going to be determining the IHSS hours? And does the health plan have the ability to cut someone's hours?
No, the health plan does not determine the hours, and we have no ability to cut hours. Often what we find is that when we do the assessment, we are talking to somebody who actually needs more hours, and sometimes often we're able to work with the IHSS liaison at the IHSS office and help them understand that the person needs a reassessment and try to make that happen as quickly as possible. And so generally we're working with people to get a reassessment done timely when that's necessary.
Thank you. I want to remind callers again, if you have a live question, please press *3. Now it's time for us to do our second poll question. And that question is, having my Medicare and Medi-Cal benefits coordinated together is important to me. Press 1 for true, press 2 false. Let me repeat that. Having my Medicare and Medi-Cal benefits coordinated together is important to me. Press 1 true, press 2 false. Okay, let's try to take some more live questions. Julie, do you have any questions for us?
Hi, Bernice.
Hello?
Hello.
Hello. I don't know if you can hear me.
Yeah, we can hear you.
Okay, I had a question earlier, and is this where you told me to hang on and wait?
Yes.
I'm on Medi-Cal. I'm 63 years old, and I first was on Social Security disability, and now I'm on Social Security retirement. So I have two. I'm on Medi-Cal, but I'm not on Medicare. But I do have a plan, which is Anthem Blue Cross. What you're talking about is entirely different than what I get. Is this something that I'm going to have to choose over what I have already, or something that will enhance what I have already, or what? I don't understand why I'm what I have.
Is there a reason you don't have Medicare yet? Have you just been on Social Security for a year?
I've been on it for longer than a year.
Almost, has it been 2 years?
It's been longer than that. It's been more than 10 years, I think.
Okay, but you don't have Medicare. You just have Medi-Cal?
Everybody says, do you have the red, white, and blue card? And I don't.
You don't have the red, white, and blue card. Okay.
No,
I don't know why that is, but nothing. If you're not a dual, this program's not going to affect you. What you will see change is that you are right now an Anthem Blue Cross because you have Medi-Cal. You're in a Medi-Cal plan. The only change you should have seen.
I love it too. It's great.
Yeah. Oh, good. The only thing you should see is that you should have gotten a letter from Anthem telling you that they were going to be responsible for your long-term services and support. You should have gotten that letter.
I may have gotten it. It's been so long, and I've gotten so many correspondences, so I may have gotten it, forgot.
And all that means is that your health plan is now going to help you coordinate your long-term services and support. So, as Deborah was saying, if you, for example, had some problems with your IHSS and the county social worker wasn't increasing hours and you needed an increase, your health plan could help you with that. They could help you maybe if you needed a CBAS evaluation, maybe you need to go to a CBAS site. That's the only thing that's changing for you. You don't need to make any decisions, and your health plan will stay the same as long as you're happy with it.
Well, I believe that I've been on IHSS in-home care. I get confused with those letters. I'm sorry.
We all do.
I was living in one place, and they relocated us to another. And the girl that was at the time who came and was my care provider, just before I moved, had a car accident herself, and she was hurt in it. So once I got here, I didn't have a phone, so there was no way I could call anybody to tell them that I didn't have anyone to come in and help me. And they dropped me in March, but I got reinstated back onto it. But this time they lowered my hours. They cut my hours. They were in the 46 hours or something like that a month. Now they're 35 hours a month, or just over 35 hours a month. And I don't know how to, I need more hours. I don't know how to get them to see that.
Yeah, I think that's where you'd want to talk to your health plan and see if the care coordinator could help you negotiate with the county to get a reassessment for more hours.
That would be nice. So I would just talk to my caseworker?
Yeah.
Okay. So
Thank you for that. Go ahead.
Shelly?
Do we have any other questions, Julie? And I apologize for cutting it like that.
Shelly, do you have a question?
If you're talking to me, yes.
Yes, go ahead.
We are.
Okay. Yes, I think it was actually covered before, so I actually have a second question, but let me reiterate it. It's like we already have our doctors, and we opt out, and we're going to have just the Medicare for our doctors. And you're saying that we're going to do what if they refuse to accept the Medicare only as the payment? Repeat what our options would be.
So the doctor doesn't have to be contracted with the Medi-Cal plan to bill for the Medi-Cal portion. So that's the first part. So if your doctor thinks that that's the case, you can have them contact the state, plus there's a fact sheet that the state has online that describes that. What happens is that they submit the payment to Medicare, Medicare pays their portion, and they submit the Medi-Cal portion to whatever Medi-Cal plan you're in, and then that Medi-Cal plan they are required to pay the Medi-Cal portion of the payment if there's anything due. Doctors go ahead.
Yeah, no, go ahead and you finish your statement, then I have this other part of the question.
If your doctor says that they're not going to see you anymore because of that, you'll want to tell them that they're misinformed, and you can give them those resources, and you can also contact the ombudsman who can help you with that. And again, their phone number is 855-501-3077.
Okay. Are the people from Molina still there? Because the question would be addressed to them, but it would also apply to some of these other health plans as well.
Yep, we're still here. Go ahead.
Okay. Because I am a senior, I'm interested to know if Molina and any of the other health plans have specialist gerontologists, and also do you have osteopaths, because that's going to help me decide what I'm doing, because those types of doctors are important to me.
Yes, we do. And if you are a member and you call into member services and you tell them what type of a provider you're looking for, they can help you go through the directory and locate the type of doctor you're looking for. And if you feel like that you're not really getting a good answer, we can have a case manager work more closely with you to help you really go through that provider listing, identify physicians that may be close to you that you'd be willing to travel to. So we would do everything we can to link you with the type of physician you're looking for.
You want to take one more last question?
Let's do it.
Okay. Julie?
Yes.
You have a question?
Yes, I do. I wanted to know if there a way to look up to see if the doctor accepts the Medi-Connect plan? Is there a way to look up the doctor?
Yeah, so there are both, all the health plans have to have provider directories online that are available. You can also contact the health plans and they can mail you provider directories. Here in LA, they're going to mail you a smaller directory that's by zip code, because if they mailed you the full directory, it'd be like 2,000 pages. The other way you can help, or you can figure out which providers are in which networks and which drugs are covered under which plans' formularies, is you can use the HICAP, the Center for Healthcare Rights, and they can help you look at all the health plans. They have counselors that can help you do that. And their phone number, again, is 1-800-434-0022. I really recommend that people use the Center for Healthcare Rights when trying to figure out which Cal MediConnect plan they want to choose, or if they want to join a Cal MediConnect plan, because they can help you work through all the factors that you have to think about when you're making this decision. And there are a lot of factors to think about.
Amber, could I also add that someone could also call the Health Plan Member Services, in which they're trained, experienced folks to be able to help you, walk through what providers are available in your zip codes close to your home. And so I'd encourage you also to do that if you would want to follow that path.
And if you have access to the internet, check online, because we all of the health plans have the Cal MediConnect providers and their provider directories, online directories, and that way you could do it at your leisure. Okay, Greg.
All right, thank you. Those very good questions. All right, I think it's time to do our third poll question, and then we can come back and talk a little bit more with Molina. So our last poll question is, I would like my home care worker to participate on my care team. Press 1, yes. Press 2, no. Again, I would like my home care worker to participate on my care team. Press 1, yes. Press 2, no. All right, tonight we wanted to really spend some time on care coordination, and you guys have all talked about it, but mostly in kind of a clinical way. I wondered if you could kind of maybe give us a personal example or a case that you worked on where you coordinate, help someone coordinate their care for a successful outcome.
I'm glad you asked that. This is Deb speaking. I have a letter in my hand from the mother of one of our members who was writing to talk to us about the quality of the care coordination she received. And she writes that she's the mother of a 33-year-old man who was covered by Molina Cal MediConnect. She mentioned that he had a mental illness along with many other health problems. And he was offered the opportunity to switch to Cal MediConnect, and they thought it would be a good idea. And she mentioned that in general it felt like it was a rocky transition because they had 5 different doctors. He had a general medicine doctor, endocrinologist, ophthalmologist, psychiatrist, podiatrist, and so on. And so when he came to us, he had just had an eye surgery, and they were very concerned about being able to continue with the eye surgeon that treated him. So our job was to make that happen quickly so that he could follow up with that physician and not have anything go wrong after the surgery. Now, the interesting thing was she said he had very low vision, didn't remember details very well, and had difficulty filling out paperwork and making calls. And so Mom was helping him, but she lived in Sacramento and he lived down here. So it was difficult for her to help him in a way she felt was effective. So one of our care coordinators began to work with the mother and the member and to sort all of this out, and we were quickly able to establish an appointment for him with the eye surgeon so he could continue with that physician. And then over a short period of time, he also was in need of services of a podiatrist quickly, so we were able to arrange that. And so what was really touching about this story, which is really telling about this, is that she said to us, when you're on the outside looking in, it's really hard to know who to talk to, where to go, what to do. And she said she really emphasized how frustrating that can be, and how that she said, I really, really needed help, and I got the help I needed. She said, you really just, she says, we needed someone to guide us, because she just couldn't figure out what to do next. And she felt that care coordination really took them down the path they needed to go and helped them get services timely. So this is the kind of care coordination we do. We start with what's on the mind of the member when they call. We start where they are. We address their most pressing issue. And then we go beyond that if there's a pressing need, and then we determine whether or not we can be of assistance to them over time with ongoing case management.
Great, thank you. That was a good story. You know, I was looking at the results of our poll question, and over 74% of the people said that care coordination was important to them. And if I understood correctly, this all begins with this, what you guys are calling a health risk assessment, which from a patient's perspective could sound kind of scary, you know. Can you kind of explain what that, a little bit more about that? You know, are you guys looking for risks? And, you know, again, how does the coordination piece work?
So initially when somebody joins the plan, sometimes we get some information from the state, and that starts the ball rolling to help identify who might be at risk and who we should reach out to most quickly to. So we start there, and then we reach out to the member telephonically, and we try to contact them and conduct a short health risk assessment that helps indicate who is in need of assistance right away for care coordination. Often, in many cases, we don't receive an accurate phone number, or we're not able to reach the person. So we send our community connector staff out into the field, and they try to locate the member. They often go to the last known residence or address, and they try to reach out and talk to the member and invite them to participate in the health risk assessment. And sometimes people are pretty surprised when we knock on the door, and we hear if they have reactions to us being there. Usually it's surprise. Sometimes they're not happy to find out they're in Cal MediConnect, but we spend time with them explaining the program, why we're there, and often they're willing to engage with us and accept the health risk assessment. That's the answers from that assessment help us develop a care plan with the member. And that's a prioritization or a list of things that we're going to help the member with that the member approves. And then we go from there, depending on, sometimes we can solve things quickly, sometimes it's a longer-term relationship, and people need help over time. But either way, we really try to start where the person is with their greatest concerns.
Great, thank you.
If I can add to that, Greg, the
Sure.
really beauty of Cal MediConnect is the idea that conversations between organizations, between long-term supports and services that never used to happen. We've been involved with the other health plans and some other community partners in a lot of collaboration. We have IHSS liaisons. We have community-based adult services, CBAS liaisons, all very connected to the health plans. What really makes this program different is the fact that we're all talking, whereas these conversations didn't happen before. And a member can, that might be utilizing some of these services really can take full advantage of them when they're talking to their case manager because of the collaboration and connections that we've made.
I think that's great, Lisa. And this is Richard. I'm just going to add, Greg, before we kick it back to you, is that, again, another beauty of this program is that the state of California and the federal government have held a single organization responsible for the health and wellness of individuals that are either choose or assigned to us. It's really important, as Lisa talked about, a lot of agencies not talking. A lot of individuals probably say it's tough for me to talk to all these different organizations to make sure they're talking to each other. You have a partner, a healthcare and a social services partner in Molina Healthcare is to help you through that very tough and complex system. And we're there helping you achieve the goals as Deborah laid out as to what you want to achieve as an individual in your healthcare and social services needs. So it is a partnership, and we always enjoy the opportunity as to serve folks in the Cal MediConnect program.
Thank you, guys. I think partnership is the key, and I think once people understand that, they'll have a different, perspective of Cal MediConnect. So we have a few minutes left. Julie, shall we take a couple more live questions?
Yes, Crystal?
This is she. This is me, Crystal. Can you hear me?
Yeah.
Okay. My question was, I have Medi-Cal and full disability from a spinal cord injury, and I've had major back surgery from severe scoliosis on top of all that. But I wanted to know, you say that when we do get this blue envelope, you have to make a choice or you'll make it for us. Is that correct?
Yeah, that's correct. When you get the blue envelope, if you don't make a choice, either by calling healthcare options or by mailing back in your choice form, the notice will have a default plan on it, and so you'll automatically be enrolled into that plan, and it will be a Cal MediConnect plan. So you're going to want to make a choice.
But all of them are Cal MediConnect, but 3 different types. Is that what it is? You can say you don't. I mean, for me, my main problem is that my therapy has run out after this surgery, and I need more therapy. And Medicare and Medi-Cal aren't going to, they only pay so much. I don't know how that. Everything else, I feel like Medi-Cal has done fine for me, and everything, because I get home care and all that, but my therapy has run out. So I don't know if that can help with that. I don't think it can, really.
Well, I can't speak for Molina or the other health plans, but part of the Cal MediConnect program, the goal is to keep you out of a nursing facility or being readmitted to a hospital. So the Cal MediConnect plans have to provide you everything that Medicare pays for and Medi-Cal pays for. But the health plans also have the option to provide you with additional services to keep you out of a nursing facility or out of the hospital. And so additional therapy might be something they would be willing to offer to keep you living in the community, because that's far cheaper for them than you going into a nursing facility. So that's a factor that you might want to consider when deciding whether you want to join a Cal MediConnect plan.
Okay, let's take another one. Michael?
Yes. Yes, I'm here.
Go ahead.
Okay, my question was, it's kind of been answered, but I'm very happy with my doctor now, with my physician now that I have, and I'm a Medi-Cal Medicare person, a consumer, and I have been that way for several years. I have cerebral palsy and anxiety disorder, and I'm 51 years old, approaching senior age. So that's my question. But I think that it's been answered several times that I do have to fill out the blue questionnaire and just state what my needs are. My other question is how are the services going to be expanded for a Medi person? And the quality of services? Do you see that happening in the next years or so?
That's the goals of the Cal MediConnect program. The Cal MediConnect plans are required to provide you with benefits that you're already getting. They're also required to provide you with additional vision and non-emergency medical transportation. And then they're required to provide you with care coordination. And the goal with care coordination is that the quality of your care will improve with that care coordination. So that's the goal of the program. And so hopefully, yes, that's exactly what will happen.
Thank you, Amber. Let me take this opportunity to thank Amber, Richard, Deborah, and Lisa for being on our call tonight. And I also want to thank Julie and Juan and the rest of the screeners that work at PASC and help make this call possible. And I want to give you guys a couple of important numbers again. The Healthcare Insurance Counseling and Advocacy Program, the one we've been calling HICAP all night, that number is 800-824-0780. And that's 800-824-0780. And I'd also like to invite you to participate in our next town hall meeting, which will be next Wednesday night at 6 o'clock. And we're going to continue this discussion about Cal MediConnect, and we're fortunate to have representatives from all the 5 health plans. And again, this call was sponsored by Molina, and I want to thank you guys for that. We really appreciate you helping us get the word out. And again, if you're still on the call, you're going to hear, you'll be prompted to press 9 if you would like to leave a message. So in a quick closing, anybody on the panel want to add anything before we go?
Greg, this is Richard. I'd just like to say thank you for hosting this evening. And as I said before, Amber, great overviews. We're glad to be here tonight. It's really important about getting message out and for people fully understanding. We hope everyone takes the time when they get the notification about the program is that they really look at it very closely and don't make a real quick decision, because there's a lot of benefits to this program, and we hope you look at them really closely and ask questions about it so that you make a real informed decision. So with that, Lisa or Deborah?
If you have any specific questions about Molina, we would like you to give us a call at 877-665-4627. That again is 877-665-4627. We'd be happy to answer any specific questions about Molina that you might have.
And Greg, this is Amber. I just want to make sure, I think Deb brought this up when she was talking about the health risk assessment and having trouble finding people because their address and telephone numbers were incorrect. The problem is that some people haven't updated their addresses and phone numbers with the county. And so if that's not updated, there's a possibility that you won't receive your blue envelopes. And then you might get passively enrolled into the program, and you might not want that. Or the first time you have any knowledge of being in the health plan is when the health plan calls you or shows up at your door. So I think it's important that people update their information with the county so that they receive their notices.
Great. Thank you again. Unfortunately, our time's run out. Hope to hear from you guys next week. All right. Good night.